So, first thing, before I get into the topic of infant first aid, I did want to just throw something out there about summer health and just introduce us a little bit. Our mission is to raise the healthiest generation of children, and how we go about doing that is we provide pediatric care that is very easy and accessible to parents. And so we basically have built a platform where parents can just text us anytime they have questions, and they'll get an immediate response. They also are assigned, something different than you see in perhaps like telehealth platforms is we actually get, we assign every family a lead pediatrician who gets to know your family over time, as well as specialists. So, if your baby ends up not really feeding well, you can talk to your lactation consultant at Summer Health. If your baby, if you want to start solids or they're a very picky eater, you can talk to the nutritionist. We have a sleep consultant for sleep training and other sleep issues, and even a behavioral and developmental specialist as well, in addition to having just a very experienced pediatric team that can do urgent care as well. So things like diagnostics for ear infections, or we can write prescriptions as needed, or just let you know, can you take care of this at home versus going into the ER for something. All righty. So
I'm on a call.
nope. If folks can mute, actually, I think I can mute folks on my end. 1 second. I'm going to mute folks.
You just have to turn it on and click on red.
But if you have questions, please unmute yourself or just type it in the chat. So I just wanted to say a little bit more about Summer Health. And so our provider group, which is the essence of what we are, has 3 main pillars, which is clinical quality. It has, just very experienced pediatricians and pediatric specialists. And we sort of hire them not just based on their experience, but also how good they are at communicating, and really having a great bedside manner. And then thirdly, we really try to get pediatricians and providers from all walks of life and all parts of the country who will know our patients better. And so we really try to emphasize diversity as well. And so that's Summer Health. And I'll show you basically how to get access through ULA towards the end. But we really encourage folks to sign up and give us a try. It would be an honor to take care of your families. All right, so for the main topic of today, I wanted to talk about infant first aid. So, I actually have a poll here. Let me see if I remember how to polls. Okay, so I just wanted to get a sense of who is in the room in terms of how old the children are, or if you're still pregnant. So I'm going to launch this poll, and hopefully this works. If folks can sort of just give me a sense of what stage you're at, and so I can, slightly tailor my talk based on that. Okay, so it seems like about 60% are in the pregnant stage, and then we have 1 in 5 has a 3-month or less, and then the remaining are either 3 months or older. So a really good mix of sort of people who have babies already and are in the thick of it, and then ones who are about to embark on this amazing journey. So we're going to end the poll there. Thank you, folks. I think what I'll talk about is why infants first aid is really important. I know it's sort of sometimes hard to discuss topics that you don't really want to think about, your child's getting injured, but I think just knowing what to do, and I think a lot of these things are sort of important to just sort of internalize. You don't have to memorize it, but like you just sort of hear it once, and I think it does stick there. And then the more you see it, the more it'll be, you'll be ready if the need calls. I also just wanted to demystify it a little bit in the sense that obviously having a child is a tremendous amount to worry about on all fronts, but I think some of the medical issues that happen, I think we sort of I see a lot of parents just sort of panic and not know what to do. And I think just knowing like what a provider would do or what the right thing to do in the moment can help demystify it a lot. So first I'll talk about like why we're talking about this, but then I'll just sort of go through the bread and butter injury types for children or infants, and then we'll do a little bit of CPR and baby proofing. The last thing I'll say is like this is not meant to be fully comprehensive because we don't have time in the time allotted, but I do have a lot of resources on the slides, which I'll share after the call, and we're recording this as well. But the resources that are on the slides are really good and highly credible. And if you want to do further reading or videos, I encourage you to check those out. Okay. So why infant first aid as opposed to just overall first aid or, children first aid? Infants, which, I define as the first year of life, have differences that, lead them to have specific injuries, or a higher risk of certain injuries compared to others. So just going through this list, I think as we all know, babies are top heavy, so they have big heads, and then combined with the big heads, they have weak neck muscles. And so that means you have an unstable, heavy head, and so you're much more likely to fall. And actually, when you do fall on your head. So that's a big risk. They are thin-skinned, which is really important on a lot of fronts. I think it's important to know that if you're out, outside and it's really hot outside, as today in New York City, it's a little warm, and yesterday even warmer. They just get hotter faster. They get colder faster. They sunburn faster. So it's really important to just remember that, and they need a little bit of extra sort of support with environment. They're obviously very curious as they get older. Some of the moms of the 3 to 6 month olds can attest to. They will explore as much as they can with their mouths. And so it's important to know. They have very sensitive eyes and ears, right? So just bright screens can be actually cause damage in young babies. And then also they're more sensitive to hearing. So my culture is from the Middle East, and we have very loud, boisterous weddings. And I feel like every wedding I go to, I have to talk to a family that has like their 2-month-old baby on the dance floor without earmuffs. And I just sort of, kindly try to tell them, maybe leave the baby on the side while you're busting a move, because I don't want the baby to have ear damage. It's always awkward, but I just like can't watch it too much. And then, they're soft bone. They're still developing their immunity, of course, so that makes them more susceptible to infections. And then lastly, they can't talk, or I should say we don't understand their language. They're definitely trying to say something most times. So definitely these attributes make them more susceptible to certain injuries. Before I actually get to the next slide, I actually have another poll, which is a little bit of trivia about what are the most common causes of injury. So let me see if I can launch that. Okay, so folks, take a guess at sort of the most common injuries as seen in a pediatric ER. All right, so I can't get anything past you guys. Falls is definitely, let me end the poll because I think we got it, and then share results. Falls is definitely one of the most common injury that we see babies for in the emergency room. We also, it's interesting. So falls are the most common. Choking, suffocation is the most dangerous, the one we fear the most and the most lethal. Really good guesses there. I have a graph here. Let me close this poll. As you can see, about half of all sort of accidents that babies are brought in for are falls. The most common things, as you can imagine, are beds, cribs, changing tables. They become mobile before you expect. Even, I've seen 6-week-old babies roll off the changing table before. And so Always good to know while they're very young to always, be by their side if they're on an elevated place. As they get older, 6 months and above, but really like 9 months, the number one thing is high chairs. We see that all the time. And then also around that age, we also see walkers, and that just sort of allows them to be much more mobile than developmentally they're supposed to be. And so we see kids getting in trouble with walkers, and pediatricians are not in love with them. Other sort of things that we see, are there as you can sort of see a thin, lighter yellow sliver for suffocation, and then the orange ones towards the bottom for foreign body. Those are both sort of choking episodes, and those are definitely the ones we worry a lot about. Fire burns, it's 4%, but it's definitely something that babies, we worry because it's much easier for them to get a deeper burn, again, because of that thin skin. And then thankfully, transportation related injuries is just 5%. I will say that, like, I think as a nation, we've gotten a lot better, but it's still, we don't have universal usage of car seats. And then there's so many out there that all have different instructions, that I always tell parents to like really use YouTube liberally when installing their car seat or fastening their child to the car seat, because I've seen definitely a lot of people do it wrong, and it is super critical to fasten children to car seats. All right. So the first sort of first aid thing that I want to talk about is choking. And obviously this tends to be for a slightly older kid, so not the first couple months, but a little bit later. But they will want to put things in their mouth that they shouldn't. And God forbid if that happens, it's really important to know what to do. I think for younger babies, it's also important to know because sometimes, not always, but sometimes babies will vomit. Like, let's say they just had a huge, bottle of milk, or just breastfed, and then they'll vomit and perhaps like choke a little bit on their milk. Most babies, they protect their airway, but it does happen. And so signs that they are choking. And here I actually want to emphasize the word conscious in the title of the slide. That's really important. If we'll talk about CPR at the end, but conscious meaning that they are awake and seem responsive to you, then this is what you do. If they are unconscious, then you do CPR. Again, I'll talk about that a little bit later. But signs that the baby it might be choking, so not breathing, not crying, or coughing. This also happens. They could have like a high pitch breathe. I didn't write that on there, but if they're choking or something is down there, but it's not fully obstructing their breathing, so you could hear like a higher pitch sound, which is similar to what you might see with croup as kids get older and they get a croup infection. So it's very different. We don't do the Heimlich maneuver for infants. We do back blows. So exactly as you guys see in the picture here, the first thing we do is sort of put the child on their belly in the palm of our hand, and then lower their head so it's below the level of the stomach. And so you want gravity to work for you. And then with the heel of your palm, you do 5 back blows. After the 5 back blows, you turn them around as the second picture shows, and you do chest thrusts, and that's 5 times as well. So you take 2 fingers and you find the sternum bone, which is the chest bone, and just go slightly below the nipples and push 5 times to really try to, if the back blows didn't do it, sometimes you have to go from the front to try to create the force to squeeze whatever is occluding their airway right out. I've included a video that is excellent and sort of demonstrating this on, I think, like a dummy baby, but it is something that I think all parents should be able or should know how to do, and hopefully will never have to do, but should know how to do. Any questions about choking or anything I've said before? And I see the earmuff questions. I promise I will get to those towards the end. Sorry, I didn't see those earlier. And the link of the video, it'll be in the slides, but and you can click on it. I will share, but I'll share the link as well. So I'm seeing some questions about choking in the chat. So it is good for up to 1 year. Thereafter, you can start to do something closer to the Heimlich maneuver because kids are just much more robust and they have a larger abdomen. And the Heimlich is really about creating a lot of pressure in the abdominal space to force everything up out of the chest. Proper asked a really good question about like how hard to slap or push. It's really it's hard to say because I think that's why the dummies are really helpful. Like you definitely don't want to be gentle, but you don't have to like really punch. You really just kind of give it a nice like maybe something a little bit stronger than like if you are trying to get ketchup out of like a glass bottle, like those old ketchup bottles. And the slides, Sandrina, I will share after the video. And then LifeVac. So I won't click on the link, but I think so there you will see, and you guys probably, if you're on Instagram or other social media, might already be getting ads around these devices that actually sort of try to suction whatever is occluding the airway out of the child. I'll say that in healthcare, we are not trained to use them because I think we haven't like really seen them studied robustly and kind of shown to work. So they're not, necessarily sort of AAP approved, American Academy of Pediatrics, or some of the emergency institutions like the American Heart Association that conducts a lot of the CPR training. Doesn't necessarily endorse those kinds of devices. So I've never used it myself. I will say my wife did succumb to the social media advertising, and we do have one in our kitchen. Thankfully, we've never had to use it. And if the moment arose, I think I would first certainly try the back blows before. It was not an approved purchase by me, but it certainly exists, and I can't speak to sort of the efficacy compared to back blows because I don't think there's been any evidence one way or another there. All right. So the next thing is that biggest category, that biggest wedge, which is falls. And so I won't get into sort of all the sort of like how they fall and what the injuries could be. I will say that as we discussed, babies are very top heavy. So unfortunately, falls do tend to be on their head. The front of the head is the safest for them just because that's like the thickest part of the skull. But certainly that does not mean that they can get a serious injury if they fall on the front of their head compared to the back. I think if you have seen the infant fall and you suspect an injury to the head or the neck, God forbid, but it's really important to try to not move them unnecessarily. So like that's something that you'll see, in sort of emergency response systems where they try not to move the patient's head or neck if possible, just in case, because there is a risk of worsening the injury there. If the child is responsive, and I should say like most children are completely fine after a fall, but there certainly are cases where it's worse. Things to look for are signs of swelling. Really, if the baby is like preferring, let's say, is tilting their head more in one way or another. Signs of a serious head injury, which I have there at the bottom, would be drowsiness, vomiting, certainly loss of consciousness, irritability, and fluid leaking from the ears or nose are all huge red flags, and you should bring them to the ER immediately. This is like, I don't mean to sort of promote our own company, but it is something that we get a lot of. Parents text us, "Oh, my baby just fell, and I don't know if I should go to the ER." And we'll often sort of see what the mechanism was, if the mechanism was high enough to create a serious injury, but then also where the injury was. So if there's like a slight bump on the forehead, that's probably okay, but if it's on the back or the side of the head, less so, and might need to be evaluated and monitored. Again, in the emergency room that I work at, it's a lot of high chair injuries that I see. And one other thing that I really liked in the graphic here, I believe they had, sort of in the left-hand side, the third picture from the bottom, the stairs. So just last week, I actually had a child with unfortunately, with a really severe head injury from the mom carrying the child and falling down the stairs. And so, not saying it's going to happen, but it's just something that, like, if you can, hold the railings of stairs if you have stairs, and sort of just take precautions like that. This infographic, I think, has a lot of good things that seem obvious, but sometimes parents forget. All right. Oops. So burn injuries, you know, uh, I think babies, younger babies often don't get burned just because they're not, mobile enough to be exposed to hot injuries. But the second they do become mobile, that is really when the risk goes up. Like my younger daughter recently, like we were at a house and there, like the stairs had these like spotlights, and she touched the spotlight and her finger started blistering. And I think if I touched it, my finger would have been fine mostly, at least for the duration that she was touching it, again, because they have such thin skin. Um, just as with adults, I think the best thing to do is run cool, not cold, but cool water over the burn for several minutes. And definitely don't use ice because that can cause ice burns in babies. And then to really clean it and cover it with a dry cloth. I would say, like, the younger the baby, the more likely it is that it's a deeper burn, and more likely that it needs to be seen pretty quickly to be cleaned and dressed appropriately. But if it's a quick superficial burn, you can often take care of it at home with just covering it with a dry cloth, or even better, if you have, there are like sterile gauze that you can buy at the pharmacy that you can dress the wound in. Better than a Band-Aid, just because the Band-Aid can stick to the wound itself. In terms of trying to help it heal, I know a lot of people try to put ointments or creams or butters or lotions, and in general, we try not to, especially baby skin that is very sensitive. The best thing to do is really just protect it and try to help it heal. And then most importantly, deep burns, so more than superficial burns, are really important to get seen immediately. Covering a large area of the body, or in a sensitive area like the mouth, the fingers, the genital, are extremely important. Any sort of electric burn, which is more for the crawling and walking stage, but really important to get seen as quickly as possible. The other thing I'll say is it's a sunburn, so slightly different, but again, the thin skin means that babies sunburn much easier. And so just think about sort of, the best thing is you can't really use sunscreen in the first 6 months, so try to use sort of barrier protections like obviously clothing, but also sort of, strollers have the covers and things like that. And then above 6 months, you can use both sunscreen, but mostly clothes, hats, and clothing. A couple more questions coming in. So I definitely, Sandrina, for ice, to be honest, I think cold water is even the recommendation for adults or older children. So I don't think ice is recommended, just because it can cause the ice burns if it's done. And oftentimes when you do have a bad burn, your sensation is lower, and so you might not feel that the ice is causing damage. What age do you recommend using sunscreen? So 6 months and above is definitely an SPF 30 and above is the minimum, but for babies, I would do even 50 and above. And broad spectrum is what you want to look for as well. Aloe vera is a great question because it is obviously something that we know is helpful for skin and helps healing. In infants, this is a difference where their skin can be really, really sensitive. The sort of best practice is to really put minimal on it, and just kind of protect it with that gauze or dry cloth. But as older kids, you can definitely put aloe vera to try to help heal it. So great question. Okay, cuts and scrapes. So for the younger kids, also less of an issue because they are just like not moving enough to cause the sort of mechanism for a cut that's significant. I will say that in the newborn phase, the most common thing I do see is parents want to clip the nails of the baby, especially if like the baby has been scratching their face. And it is a very precarious endeavor because it's really, really easy to cut the skin of the finger. And if that happens, don't worry. Yes, it obviously hurts, but it'll heal. But that is definitely the most common sort of in the newborn phase cut or scrape that I do see. And which is why I recommend for nails, especially if they're scratching themselves a lot, to file the nails rather than clipping them, just because it is so easy to cut the skin instead. For as they start to crawl and then walk, obviously, sharp corners are a big risk. And even at our house still we have a 3-year-old and a 5-year-old, we still have sort of these like rubber corner cushions on our dining table. If the child does get caught, I think this is where it is mostly similar to other kids. So it's really just applying gentle pressure to stop the bleeding, cleaning it with a gentle soap, and then applying a sterile bandage. If it is a large enough cut, or certainly a place where, like if they got cut by something that was dirty, you can apply antimicrobial ointment. Neosporin can actually be really irritating to the skin, especially for younger kids. And so we recommend bacitracin or mupirocin, which is, if any of your babies have had really bad diaper rashes, that's also what we sometimes recommend if the skin has started to break down. And then because their immune system is still developing, they are at higher risk of getting an infection from the cut. And signs of that would be really if there was redness or swelling or pus, and that would be a reason to seek pediatric care quickly. All right. Okay, so poisoning, the most important thing is this number at the top. So 1-800-222-1222. They also have a website, but basically nationally, this is the phone number no matter where you are. And then it kind of routes to your local region. But there's also the poison. This is the number for poison control. They also have a website and probably an app, but the fastest thing is just to call this number. And if you can, the most important thing to do is to identify what the child might have ingested. And so, first of all, oftentimes parents don't know what might have happened, but signs to look for are drowsiness, behavior changes, an unusual odor. Certainly, if you see, fragments of like a pill on the lips or on the clothes, heavy drooling, that's worse. I think isolated, no, but like if they also have some of these other symptoms, if they throw up, or just sort of are acting very different, that might be a sign that they have gotten into something that they shouldn't have. Once they're sort of crawling or walking, in addition to medications, edibles is a big thing that we see, and the child will act very strange, and unfortunately we'll have to do like a head CT in the ER. So just obviously things that can cause trouble, just keeping them out of reach for the baby. one thing to know is like never try to induce vomiting in a baby or an adult even. It can often just make it worse. They can sort of gag and not really vomit. And it's not something that's recommended. But what is really just calling poison control, and they literally will walk you through whatever steps need to be done, whether that's bringing them into the ER or providing reassurance, or let's say like they didn't ingest it, but their eye got exposed to soap or something else, how to rinse it out for 15 minutes over the sink or something like that. So that's really the take-home message is 1-800-222-1222. We have a question. Okay, so for Sandrina, I'm just going to put it in the chat. The other creams are bacitracin and mupirocin. I might have gotten the spelling of the second one wrong. And then, so for pets, great question. Bites are bites or scratches are higher risk for the reasons we talked about already, for infants, that for higher susceptibility to an infection if they're scratched or bitten by a pet. Cat bites tend to be worse than dog bites because they just have sharper teeth, and so there's it's more of a gash rather than like a crushing bite. I would say if in like the first 3 months of life, if there's a significant animal bite, that they should be seen immediately, regardless of if you're worried there's an infection or not, because often we will have to do what's called prophylactic antibiotics. So give them antibiotics even if there is no infection right now to prevent an infection. Scratches, I think, can be treated if they are superficial, just at home with conservative care, and like really, you can apply Vaseline or something, but really, and that's like really just to protect it, and then monitor for signs of infection, but it's lower risk than a bite. Okay. So, all right, so CPR, hopefully, this is like the reverse jinx or something. We're talking about it so you guys will never have to do it. But I think it is really important to know CPR is slightly different. So if you have been trained for adults, it again is slightly different for kids for in a few important ways. When to do it is the most important thing, and that's if the child is unresponsive. So you are talking to them, you're trying to sort of shake them, and they're just not responding to what you're doing, and they're not breathing, or they're only gasping. Then you start CPR. And this single slide is not meant to be CPR training. There's an instructional video. There are courses online. I think there are also like community resources available to if you want to go in person for CPR training. But this is really just an exposure to it. When a family has had a sort of scary situation in the hospital, we often give them a video to watch before they go home, just so they know what to do next time. I think it helps sort of them cope with potentially scary things. As opposed to adults, the number one reason why adults need CPR is something involved with the heart. Their heart stops. For kids, it actually tends to be, especially young kids, it's in infants specifically, it's much, much more likely to be from not breathing. So things like suffocation, choking, or severe asthma, a burn in the breathing tube, near drowning, all the things that you see here are really important for things to look out for that when CPR might be needed. I won't go through all of the steps, but suffice it to say that are covered here in the simple infographic. But when you need to do it, you also need to call 911 and call for somebody to help as it's happening, of course, so that help, especially trained help, can come as soon as possible. If you don't remember anything, it's trying to do 30, basically it's 30 and 2 is the ratio we talk about. So you do 30 compressions, and again, it's the 2 fingers on the sternum that we talked about for the choking episode, and pushing down about an inch or so of depth in the chest wall. And you want to do it pretty fast. So more than once a second, you want to push down. So here it says 100 to 120 compressions per minute. So that's almost 2 per second. And you give 30 compressions, which is really trying to get the heart going. And then you give 2 breaths, rescue breaths, as is shown in picture 5 here. And then you go back to the 30 compressions, and you keep doing that until more help is there. And hopefully, again, you'll never have to do this, but that's essentially the basics of infant CPR, and would encourage folks who are interested in really learning how to do it to either watch a video. There are also online offerings where you can, I think they'll like send you like a infant dummy doll that you can practice on, that's combined with the video, or in-person classes as well. Okay. All right. So the last sort of general topic that I wanted to cover is baby-proofing your home. And actually, I was surprised when I was trying to look for a really good resource that the New York Times actually has a pretty good article that describes it. You know, I think it's probably firewalled. So just in case, I included on the slides that we'll share, there is a link here that has a PDF of the article. And then they basically interviewed a prominent pediatrician from Cincinnati Children's that goes through all the steps you do as you kind of go through your house. What are the risk factors? So it's things like, you know, making sure that high furniture, like the cabinet that you see sort of on that second floor, is secured to the wall. Obviously, protecting stairs with gates, making sure cribs have the proper height. So, you know, as the baby grows older, the mattress of the crib needs to go lower and should always be like nipple height or higher so that they can't climb over it. So all sorts of things that you may be obvious, but may not be. And so I think an article like this is really approachable to sort of learn how to do it. I don't think, I mean, to each his own. I don't think you necessarily have to sort of hire. There are experts in child-proofing homes. I think for the couple or the family that is extremely busy and has the resources to do so, then, you know, it's certainly a great service. But I don't want you to think that, like, to do it right, you have to hire somebody who does this professionally. This article kind of walks you through the things you can do. And I think with Amazon and other stores, you can really easily buy all the things you need in terms of like covering electrical outlets, or you know, the bumpers on for sharp corners, things like that. And there was a question about what age this is recommended by. So I think safety proofing, you always want to sort of get ahead of it, because it does get busy. So, you know, certainly the biggest time is once the baby starts to get mobile. So like once they start crawling, that's when you really want to baby proof the house, because then like you are going to turn your back and they are going to be moving and getting into things that they are higher risk. And so really once the baby starts to get mobile, so, you know, aim for a few weeks before that. All right. Okay. We'll do about, I think, 5 minutes of questions. You can either type it or you can unmute yourself and ask the question. I do want to I want to start off with the earmuff question because I know that a few people were wondering. Essentially, if you think that the noise is quite loud, then it is extremely loud for the infant. And so whether you're at like a stadium for like a sporting event, certainly a concert is definitely something. You know, Middle Eastern weddings, things like that. Definitely, I would recommend earmuffs for infants in the first year of life. honestly, by the second year of life, their ears are a little bit more developed and less sensitive. But there's no like sort of strict cutoff. It's really just your sort of risk aversion. Um, but certainly in the first like 4 to 6 months of life, really trying to avoid their exposure to really, really loud noises. One thing that I think is like especially common in New York City is, walking with a baby and a fire engine just sort of barreling down the street, or a police car. Usually the fire sirens are the louder ones. And, even for my own kids, I will like use my two hands and block their ears. Uh, you know, Probably not going to cause damage, but you never know, and it's better to be safe than sorry in this sort of thing. All right. So just related to the sound, is there a way we can are adequate? Great question, June. It's hard to try on yourself because obviously these are uh, too small to fit on most adults' heads. But I think like the ones that really sort of provide a good seal, like it's sort of like the soundproofing headphones, like the Bose headphones that a lot of people have, are sufficient. So like they're covering, you'll see like they basically cover the whole ear. I don't know what the certification might be that like you would look for. There probably some sort of like certification body exists, but really for me, I looked at it's like creating a decent seal around both ears. And related, Jesse and Doug ask about the sound on the subway. It depends what line, I would say, but um, I think rule of thumb is like if you feel like it's really loud to you, then it's definitely a danger to the child and would cover their ears. And then let me work my okay. Okay. So Drew asked, what hospitals in New York City are recommended for the best infant emergency care? Uh, so I would say that oftentimes the ones that are closest to you, I will say that places that do have pediatric specific emergency medicine doctors, so some of the community hospitals like out on Long Island or elsewhere might not have pediatric specific ER doctors who basically went through 3 years of pediatrics training and then 3 years of pediatric emergency training, as opposed to an adult ER doctor who did, I think, 4 or 5 years of just sort of general ER training. So, certainly the ones in Manhattan tend to have the pediatric ER. So NYU and Columbia, Presbyterian, places like that, all have it. But I think they're all great. Honestly, it depends on what the injury is as well. But like the closest one you can get to most often is the best one you can get to. Okay, Jonathan, for your question about what are the must-have items, I will include a list in my follow-up email that I'll send out that includes the slides, but that will have items that we recommend parents have for this. But great question. And seeing as how many people plussed it, I will try to include it in the slides itself next time. Emily asked about when's the earliest time we can fly with a baby. There's no like hard and fast rule there. I've seen families travel with a 6-day-old baby before. I think the biggest thing from like a safety perspective is probably, exposure to potential infections. There's no evidence for it, but like a lot of babies or families will wait for the 2-month vaccines to be given, which can be given as early as the 6-week mark, for when when it might be safe to travel with a baby. I think through COVID, we sort of learned that like airplanes have decent air circulation or filtered air. So like the airplane is often even safer than like say the subway or a building that doesn't have filtered circulation. But from an infection standpoint, I think like most people say 6 weeks, but there's no rule. Like, plenty of babies who are younger than that travel. And okay, and then Elena asked about sunscreen. So, it is felt, and I believe the Pediatric Dermatology Society hasn't moved from this, but all sunscreens, like everything gets absorbed at some level, no matter how sort of safe the materials are that the sunscreen is made out of. And so a rule of thumb is that we don't want to put sunscreen on kids who are younger than 6 months. Really, it's really two reasons. One is like the absorption and the concern there that they're so young and might be exposed to it. But the bigger thing is really the thin skin, and just like the sunscreen being sort of a insufficient protectant, right? So like a long sleeve shirt is always going to be better than the strongest or most sunscreens. And so I think it's also trying to basically say that like sunscreen is almost never adequate for babies because they can burn so quickly, and they would need so much than you and I would. So allergies is a great question as we enter as your baby approaches starting solids. Oh, thank you, Jordana. My teammate mentioned that we have a great webinar, so we do, and it is something that our dietitians love to talk about, is how to introduce solids in a way that you can sort of determine or minimize the risk of allergy, or determine what it is that caused the allergy. If you are concerned about an allergy, you should definitely seek care as if your baby is sort of feeding and developing some sort of reaction. If they develop serious allergic reaction, which is called anaphylaxis, which would be a rash plus, vomiting or difficulty breathing or swelling around the mouth, then that is an emergency, and they should be seen as soon as possible. Okay, and then I see Emily. That is it's a great question, and I think in terms of pediatric visits, there's about in the first year there's 2, 4, 6, 9. There's 6 visits in the first year, and they do cover a lot. They also cover a lot of the safety things, hopefully, or at least will give you materials about what to do for accidents and injuries. Okay. And then the last one is bug repellent. I don't have time for more, but bug repellent, I try to minimize it. I think at least until 2 years. I don't know if there are like newer bug repellents that are a little bit safer, but the old school ones like the DDT base or the other active ingredients, 2 and above is typically the rule of thumb there. Lastly, folks, if you ever would like to give summer health a try and talk to our pediatricians or specialists, whether it's urgent care or every question you might have, even what's the dose of Tylenol, or how do I start solids, or is this movement normal? We're here for all your questions. You can go to, I think, like the perks page on your ULA account, and we should be there. Or you can go directly to the Summer Health website and sign up with the code ULA. That should give you a free month of our total care package for free. All right. Well, with that, I'm really had fun doing this with folks. Really, really great questions, and please reach out, and we'll send a follow-up. So thank you for joining, and have a great rest of your Tuesday.